Hi there, I'm sending you this video today because we recently got the results back from your p-Tau 217 blood test. As you know, we ordered this to help evaluate some of the memory changes you have been experiencing, and the result came back elevated. I know that seeing a result like this on your patient portal can be scary. It is completely normal to feel anxious, overwhelmed, or even a bit panicked right now. I made this video because I want to sit down with you, virtually, to explain exactly what this means, what it does not mean, and to outline a clear, step-by-step plan for where we go from here. I want to give you all the information you need so that we can make the best decision for your health, together. Let us start at the beginning. As we get older, our brains naturally change. We all experience moments of forgetting a name or misplacing our keys. However, when we talk about specific conditions like Alzheimer's disease, we are talking about a very distinct biological process. Imagine a healthy brain as a busy, well-organized city with clear roads for communication. In Alzheimer's disease, two main types of roadblocks start to form. First, there is a buildup of proteins called amyloid plaques. Think of these as trash piling up in the streets. Second, there are tau tangles, which are like twisted railroad tracks inside the brain cells themselves. These roadblocks disrupt the way brain cells communicate and eventually cause the memory symptoms you might be noticing. This brings us to the blood test we ordered, the p-Tau 217 test. This is an incredible new tool. It measures a specific form of that tau protein I just mentioned. Research has shown that higher levels of p-Tau 217 in the blood are associated with an increased likelihood of those Alzheimer's-related changes happening in the brain. But I need to be absolutely clear about one thing. This blood test alone does not definitively diagnose you with Alzheimer's disease. Memory issues can have many causes, including stress, sleep disturbances, vitamin deficiencies, or other medical conditions. What this test does is tell us about your risk. Because your level was elevated, it simply increases the likelihood that some of these specific changes are present. It is a strong clue, but it is not the final answer. You might be wondering why we are checking this now. For decades, my job as a primary care doctor dealing with memory loss was frustrating. Historically, we had a few medications we could prescribe, but they only served as a band-aid for the symptoms. They did not actually change the underlying disease. Today, we are in a completely new era of medicine. This is an exciting time. We now have breakthrough medications, like Leqembi and Kisunla. These are intravenous infusions that act like a cleanup crew. They actually go into the brain and clear out those toxic amyloid plaques. They do not just mask the symptoms, they target the disease itself. Even more encouraging is the newest data coming out about these treatments. The research is showing us that the earlier we catch this, and the earlier people get on these medicines, the better they do. We can actually slow down the progression of the disease and preserve your memory and independence for a longer period of time. But there is a catch, and it is a logistical one. To get on these medications, you have to be evaluated and managed by a neurology specialist. Historically, there has been a massive delay in this process. A drug representative for one of these new medicines recently shared a startling statistic with me. Over the last few years, the average time between a primary care doctor suspecting a memory issue and a patient actually starting treatment has been 2 to 3 years. That is 2 to 3 years of waiting, testing, and scheduling delays. With this disease, that is time we simply cannot afford to lose. My aim, and the reason we are tackling this so proactively right now, is to drastically shrink that window for you. We face a very real logistical challenge here in Central Arkansas. There is a significant shortage of neurologists. If we refer you to our excellent local neurology groups right here in Conway, the wait lists can be up to 9 months. If you are willing to travel a bit further, we have other options. We frequently refer patients to specialists down in Little Rock, such as the Baptist Health System, where the wait time is roughly 5 to 6 months. If you are willing to drive even further, there are specialized clinics in Memphis where we can sometimes get patients in around the 3-month mark. It becomes a trade-off between the convenience of staying close to home versus the speed of getting seen. But no matter where you choose to go, my goal is to not let you just sit on a waiting list doing nothing. We want to do the heavy lifting of the diagnostic workup right here, right now, through our clinic. That way, when you finally walk into the neurologist's office, your visit is highly productive, and you are ready to discuss treatment. So, this brings us to a crossroads. With this elevated lab result, we have a decision to make about how you want to proceed. There is no wrong answer here. It is entirely about what makes the most sense for you and your family. The first option is the conservative approach. With this path, we hold off on a neurology referral. We delay any further advanced testing. Instead, we focus heavily on lifestyle changes that support brain health, such as exercise, a Mediterranean-style diet, optimizing your sleep, and keeping your mind engaged. We would then simply recheck your lab work and your memory symptoms down the road. The second option is the aggressive approach. This is the path for those who want to know exactly what is going on and want to aggressively explore their eligibility for these newest therapies. I want to be transparent with you. From a medical standpoint, I do recommend the aggressive pathway. I believe that gathering all the information gives you the power of choice. But I also want to assure you that I will never push you into doing something you are not comfortable with. If the aggressive path feels like too much right now, I completely respect that. If you do choose the aggressive approach, here is the exact roadmap we will follow together. Step 1 is all about safety. Before anyone can start these new treatments, we have to ensure your brain is healthy enough to handle them. We will schedule a specialized scan called an iCabrain MRI, which we can easily do right here at Baptist Health in Conway. We will also draw a specific genetic blood test called an ApoE lab. We do this because these new medications, while amazing, can sometimes cause a temporary reaction known as ARIA. This involves mild swelling or tiny leaks in the small blood vessels of the brain as the plaques are being cleared out. The MRI gives us a detailed map of your brain's baseline, and the genetic test helps us understand how sensitive your body might be to those side effects. If your MRI looks good, step 2 is the final confirmation. We will order an amyloid PET scan. While your recent blood test gave us a strong clue, this PET scan provides undeniable proof. It acts like a camera that actually lights up those specific toxic Alzheimer's proteins in your brain. This scan clinches the diagnosis and is absolutely mandatory to open the door for treatment and get insurance approval. To get this done, we will place the order, and the scan will be performed at the Cardi Clinic down in Little Rock. They will call you directly to schedule it once your initial MRI is finished. Step 3 is understanding what you are signing up for if you become a candidate for medicines like Leqembi or Kisunla. These treatments require a major time commitment. You would need to visit an infusion center every 2 to 4 weeks for your medication. You will also need frequent follow-up MRI scans during the first year to carefully monitor your brain for safety. Because of that heavy appointment burden, step 4 is crucial. To safely undergo these treatments, you are required to have a dedicated care partner. This needs to be a family member, a spouse, or a very close friend who is committed to walking this journey with you. They will need to drive you to your frequent infusions, accompany you to your MRI appointments, and help monitor you for any subtle side effects at home. Having a strong, reliable support system is not just a good idea, it is a medical requirement for this path. I know I have just given you a massive amount of information to process. Please take a deep breath. You do not have to make a decision today. What I would like you to do next is to sit down with your family or your support system. Watch this video again if you need to. Talk about the logistics, the travel, and the commitment. Think about whether you lean toward the conservative path or the aggressive path. Once you have had a chance to digest all of this, please send me a message through the patient portal or call the clinic and let me know your thoughts. You can also schedule an appointment where we can sit down and talk more about this. The main reason I made this video for you is that I am trying to do everything I can to make this process less clunky and more efficient for you. If you choose the aggressive path, there are already going to be a lot of appointments and visits required, so I want to save you extra trips to the clinic whenever possible. That being said, if you want to schedule a visit to talk through this in person, that is totally fine. Tell me which path feels right for you, and we will immediately start putting the wheels in motion. We are in this together, and I am here to guide you every step of the way. Take care, and I look forward to hearing from you soon.